Bell's palsy, also called idiopathic facial paralysis, is a disorder caused by inflammation of the seventh cranial nerve, leading to weakness or paralysis of the facial muscles on one side of the face. The exact cause is still unknown, but researchers believe it may be linked to reactivation of dormant viral infections, such as herpes simplex or herpes zoster, or possibly an autoimmune process. It most often affects people between the ages of 15 and 45. The underlying problem is thought to be related to pressure on the facial nerve. When the nerve becomes inflamed and edematous, it can become compressed, compromising blood flow and leading to ischemic necrosis. As a result, the muscles of the face lose their normal function. Patients may present with facial distortion, drooping of the mouth, drooling, excessive tearing, and sometimes pain in the face, behind the ear, or in the eye. Speech can be affected, and eating may become difficult due to weakness of the facial muscles. Despite these potentially alarming symptoms, it is important to reassure patients that Bell's palsy is not a stroke. In fact, most people experience spontaneous recovery within 3 to 5 weeks, and recurrence is rare. Medical management. The goals of treatment are to maintain facial muscle tone and to minimize long-term nerve damage. Corticosteroids, such as prednisone, are commonly prescribed to reduce inflammation and edema. By decreasing vascular compression, these medications restore circulation to the nerve and improve recovery. For the best outcomes, therapy should begin within 72 hours of symptom onset. Corticosteroids not only relieve pain, but also significantly reduce the risk of permanent denervation. Analgesics are often given to control facial pain. Some patients may also benefit from electrical stimulation to the affected muscles to reduce atrophy. Surgical decompression of the nerve has been considered in some cases, but evidence does not strongly support its effectiveness. Fortunately, the majority of patients improve with conservative management. Nursing management. Nursing care is focused on protecting the eye and maintaining muscle function during the recovery phase. Because eyelid closure and the blink reflex are impaired, the eye is particularly vulnerable to dryness, foreign bodies, and corneal ulceration. Protective measures are essential. At night, patients may wear an eye shield, while during the day, wraparound sunglasses or goggles can help reduce evaporation and protect against wind or debris. Moisturizing eye drops and ointments are recommended to prevent irritation. Patients should also be encouraged to manually close the affected eyelid before sleeping. As the patient recovers, facial massage using gentle upward strokes can help maintain muscle tone. Once sensitivity improves, simple facial exercises like wrinkling the forehead, blowing out the cheeks, or whistling can be practiced in front of a mirror to encourage symmetry and prevent atrophy. Patients should also avoid exposing the face to cold drafts, which can worsen symptoms or slow recovery. Overall, Bell's palsy is a temporary and treatable condition. With timely corticosteroid therapy, careful nursing interventions, and patient education about eye protection and facial exercises, most individuals return to full function within a few weeks.